Everyone, host of Brain Power TV, and this is our first LinkedIn Live. So I have the amazing Dr. Alana Arnold with me today, and we're gonna have a good time. We're two pediatric physicians who have a mission to improve the lives of children that we take care of in the community. And I work with foster care, and she does pediatric ER medicine. So, welcome, Dr. Alana, to the episode.
Thank you so much. I really am happy to be here. So thank you very much for the invitation.
You are welcome. So, can you tell us more about yourself? I know you have an extensive, amazing bio, but I'm going to let you introduce yourself.
Absolutely. Yes. So I am born and raised in Philadelphia, actually. And I hopped around for my medical training. I did medical school up in Boston at Tufts University. I did my residency in Oakland, California at the Children's Hospital of Oakland. And then I did my fellowship training for pediatric emergency medicine down in Houston at Texas Children's Hospital. So I have hopped around the country. And then I initially had my first attending job up in Wilmington, Delaware at DuPont Hospital for Children, and have been in Miami now for just over 2 years, working as the medical director for the Pediatric Emergency Medicine Department in a community hospital here based in Miami. So it's been a tour of the
Wow.
country, and
Yes.
my work focuses on basically allowing emergency medicine health systems integrate pediatric care into their workflow. So improving clinical standards, evidence-based medicine, protocol development, the whole shebang, to make sure that we deliver appropriate care to our children in the community
Yeah.
setting.
Wow. So, so I told you she's amazing. So, yes. So, where do we start with that? So, first of all, why did you decide to go into Peds ER?
Good question. Okay. So, anyone who knows me, I like to have fun. I am very dedicated to my clinical career and work, but I like to travel. I like to have flexible work hours. So, actually, when I was in medical school, I was thinking I would do emergency medicine. And I did my rotation, and I found out very quickly I do not care for adults. They often have ulterior motives to come to the ER to a certain extent. And with my
Okay.
temperament, it wasn't going to be the best situation. And sometimes there's drug seeking behavior and whatnot. And it's not necessarily the fault of the patient, but it can be very challenging to work with that every day, day in and day out.
I
So I always enjoyed working with children, and I did my pediatrics rotation and had a blast. Children are very honest and very intuitive. So it was refreshing to deal with them on the wards. And I found that with proper care and attention, most children are generally healthy. So
I
when they come to the hospital and they're ill, if you give them appropriate medical management, most of them get better. So it's very rewarding. And who doesn't like a cute baby? So it
exactly.
was fantastic. Even if you're
Right.
having a bad day, I get to play with the kids, and especially if it's like a family with siblings and whatnot, it's very enjoyable. So
Right.
I knew I wanted to do pediatric emergency medicine because I enjoy the shift work. I don't like being on call. I like doing procedures.
Right.
Uh, and overall, in a month's time, for example, we work less clinical hours, even though it can be very demanding. So I thought that it would be the best fit to suit my personality and what my career goals and interests were.
Thank you, because I asked you that question because there's kids and there's parents watching. So, kids, it's important for you to be patient with yourself and to know who you are, because like Dr. Alana was saying, she recognized her temperament, and that's what led her into the specific field of Peds ER. So,
Mm.
yeah, so in your, oh, I see some people in the chat. Hi, Davida
Oh,
and
yes.
Aiden. Okay. So tell me, what's the biggest issue in your opinion that's facing children in the community with regards to healthcare?
So I honestly think that it is the actual care that children are receiving in the community setting
Right,
in your regular community hospital. It's not known that 80% of kids actually are seen by non-pediatric specialists when they present to an ER. So that means that you go to a community hospital and the doctor who's seeing them is an emergency medicine doctor, but those doctors only have about 10 to 15% of their residency training focused on pediatrics. And
right.
so they just aren't as comfortable with
Mhm.
children. There can be lots of issues with misdiagnoses and
Right,
mismanagement. And then, more importantly, they just aren't equipped with the tools to care for them. So, you and I both know children come in all different sizes. And so, you have to have proper equipment on hand,
right,
and specific materials that are catered and suited for children that adult hospitals just typically aren't supplied with. So,
right,
it becomes a huge issue in terms of the proper care and proper protocols being delivered to the kids because again the vast majority 4 out of 5 kids are being seen by non-pediatric specialists and there's a huge gap in the medical care that can be delivered. So
right,
my work focuses on filling that gap, making sure that emergency medicine health systems are properly equipped, they have proper medical knowledge so that we can care for the children better in the community setting because that's where
right.
the children are going. It's fairly rare that someone's going to a pediatric hospital just because, there aren't as many
Right.
and typically longer wait times. They're usually in huge academic centers, so it's just not as easy to get to. And
Right.
so for me, my passion is to focus on where the majority of children are seeking their care and making sure that that standard of care, the pediatric emergency medicine care, is being delivered appropriately so that we can care for the children to the best of our ability.
Yes, because I'm sure you'll agree with me that children are not little adults.
Absolutely not. And that, is very true because the physiology and pathophysiology is categorically different for children.
Right.
They, you and I both know they respond to illnesses differently, they compensate medically differently, and then just the interactions with children are very different. I
Right.
always tell the residents that I work with, you have to focus on really being thorough and a great historian, but also clinician in terms of your physical exam because
Right.
a 6-month-old can't tell you what's hurting or what the issue is. And so you have to be very aware and in tune with doing a proper physical exam to help you with your clinical diagnosis and workup and things like that. So it's critically important that wherever the child is getting care, those providers have to be well versed in pediatric emergency care and know how to approach those issues and make sure that the child is getting what they need.
Amen. It is the
Yeah.
truth.
Yeah, because
The
it can
whole
be very
complete
scary.
truth.
Yeah, it can be very, very scary the transfers we get. And
Yes,
I,
I
I
know.
think part of it, and I don't know what you think, Dr. Echo, but I think we've come to this point in emergency medicine just because it was a specialty that kind of developed and people were grandfathered into it over time.
Right.
And so I think since they were kind of going off the fly, no one really stopped to think, hold on, we need to have standardized protocols and care for children in the community setting.
Right.
I, a simple example is a child has a heart condition, you would not send them to an adult cardiologist, you would send them to a pediatric cardiologist.
Right.
So why have we dropped the ball in terms of making sure that in the emergency room setting, we are delivering pediatric specialists in the emergency room setting? And so there's just been a disconnect, unfortunately, and we really have to focus on catching up and making sure that the kids are getting the proper care.
Right. No, that's critical because if we don't, then we're gonna miss more and more kids and miss
Hmm.
things that could have been prevented and maybe
Absolutely.
and misdiagnose kids that don't need to be misdiagnosed. So
Mhm.
I know that you did a fellowship in Peds ED, but there's only so many Peds ED docs. So it sounds like what you do is go into the community setting where they may not be a Peds ED doc and help them optimize their equipment and their
Mhm.
protocols to help them take care of kids better.
Yes, absolutely. So my job is to be thorough, and I've developed a system to make sure that we hit all of the aspects that are going to influence proper pediatric care. So there's kind of three big categories. The first is kind of like the rigor of the care that we're delivering. So making sure that we have proper equipment, making sure that we have clinical acumen, so
Mhm.
access to evidence-based medicine and
Right,
protocols, state of the art, making sure that we do clinical simulations to get the personnel and providers more comfortable with the
right,
pediatric cases that come in. And
right,
then another component would be resources. So making sure that we have the proper supplies. So airway equipment, suturing material, splinting material for orthopedic injuries, the whole lot to make sure that those are stocked and ready to go. And then the third component, which is very important for most hospitals, is how is this affecting your bottom line? So there's a lot of money left on the table with improper pediatric care. You can imagine that a child comes to a hospital where there aren't any pediatric specialists, they're uncomfortable with the diagnosis, they're unsure of what to do, they don't have proper equipment. Those are patients that are being transferred out of that health system. So
right,
the hospitals are actually losing a ton of money when you aren't pediatric ready, as I call it. So
right.
if you are a hospital that is not pediatric ready, you're leaving on the order of tens of millions of dollars a year on the table that are not being uh, put towards your bottom
Mhm.
line. So it really does affect the revenue for the hospital. And
Right.
so that's why it does become more financially appealing as well as just morally and clinically relevant to approach these hospital systems and say, hey, you have to become pediatric ready because, there's over 35 million pediatric visits a year across the nation in terms of emergency room visits, and 28 million of those are going to non pediatric centers. So, in the community, it's critically important to make sure that these hospitals become pediatric ready so they can give proper care, have clinically appropriate outcomes, and also increase their revenue and bottom line so that the C suite can be happy, the kids can be happy, well taken care of. So it's kind of a full circle component.
Yes. Yes, and as you were talking, I thought about something important too, which will make both C-suite and parents happy, is that their kids can stay there and get care and not have to
Hmm.
get transferred out, because transferring now puts strain on the kid, puts strain on
Hmm.
the parents,
Yeah,
and it's like work and all of those things. Is like, okay, now we have to figure out who's going to take care of the other kids left behind when we're going
yeah,
to go all these hours away to the other hospital. So I mean, just to help make the community um, feel like they're being taken care of better, it's important. That's where the community access points that they have is pediatric ready. So it just
absolutely.
makes complete sense.
It
Yeah.
does. It makes sense. And so that's my passion and mission to make sure that we really do this appropriately in a systematic way and kind of
Mm,
roll it out hopefully across whole health systems so that it can be implemented in urgent cares and
right.
emergency in the community so that it's uniform, more cost efficient, more effective in terms of the clinical care and have better outcomes for the patients.
I agree 100%. And so, if you're listening and you're in charge of a hospital, you need to talk to Dr. Alana. It's the truth.
Yes.
So, I know when we talked before, I know you also mentioned that you're interested in health education for the community. And that's where brain health comes in. So, brain health is just a general term, of course, for how do we approach helping our kids and our parents get healthier, but in all the aspects of their lives, because everything affects our brain in the end, right?
Mm-hmm.
Whatever we do in some way, shape, or form affects the health of our brain. So, how do you? So, tell me some more about the education that you do.
Yes. So any good pediatrician knows that, the mission of a pediatrician is to make sure that every child has the opportunity and support to grow and develop both physically, mentally, emotionally into a productive adult and productive member of society. So that's kind of what we're tasked with. And so when I think about health education, the vast majority of school systems don't have a robust health education for children, especially the younger kids. So my focus is three areas. One, which is very important for children, is the nutrition component. So starting even in grade school, just introducing basic information and ways to be more healthy and learning how to eat better, so that they can build these habits that they're going to carry with through their teenage years and then on to adulthood. A lot of the morbidities that adults suffer from in this country stem from dietary issues that lead to, metabolic syndrome, leading to cardiovascular disease, other complications, heart attacks, strokes, diabetes, etc. And so with the nutrition, they can make better decisions as they're growing up, and those habits can play out in their adult life. The second component that I focus on just for fun is just basic anatomy. I'm always surprised at the big gap. There's a big gap in terms of knowledge, basic medical knowledge. So I found that a lot of kids, most children are inquisitive. They want to learn, and so basic anatomy has really tied in, having them become more in tune with their bodies, right? So
Right.
knowing where your heart is, what your heart does, all of those things help a child kind of anchor in their knowledge, and
Right.
so they're going to remember those types of things and be able to express what's going on with their bodies if there is an issue further down the line. And it's just fun and interesting for them to learn about. And the third component is actually kind of more of a mentorship exposure component, where I try to just introduce them to medical careers. So, kind of along the lines of STEM, you
Right.
want to just expose them to what is it like to be a doctor? What is your typical day like? What is the journey to become a doctor or a nurse or a PA or whatever it may be? Because we take it for granted that every child may have access to that firsthand. It is not uncommon that most kids, especially in urban centers or lower socioeconomic status centers, they don't know a medical professional firsthand. So
Right.
allowing them to get exposure to what those professionals look like gives them at least a little initial push and incentive to say, I'm interested in this, I could do
Right.
this. Like, it gives
Right.
them some role modeling and inspiration to give them that support and that little push that a lot of kids need to make them think that this is a viable option for them if they're interested. And then having that partnership to kind of have a leader or a mentor help lead them through that process. So those are the three areas: the nutrition, anatomy, and mentorship exposure that I like to focus on with the kids, primarily in elementary school, but I kind of work at all levels. But I like to get them as young as possible, just
Mm-hmm.
because, how kids are. If by the time they're 10, 12, 13, 14, if they've been told you're not smart or this isn't for you, or they haven't been introduced to certain things, they're
Right.
kind of placed in a box. And so the sooner you can access them, it expands their minds, and it's very rewarding because, having kids really click and understand what's going on in their bodies and saying, oh,
Right.
this is what I'm interested in and I want to pursue it, is definitely very rewarding, and it's something I love to do.
Wow. Alana. Dr. Arnold. That's wonderful. And as you were talking, I was thinking, wow, that would be great to even start with the kids in daycares. I mean, even
Yeah,
head starts.
yeah,
They need to know
absolutely. To
about
have a
nutrition because that's where it
health
all
education
starts.
component. Yeah,
Right.
absolutely,
Yeah.
absolutely.
Wow. Okay. So you work with schools in your community to get the education out. Is that who you primarily work with?
Yeah, so I'm trying to be as efficient as possible, and so I am trying to to build partnerships with kind of the higher level school districts. So like being on the advisory boards and things like that, so that it can be disseminated and rolled out across multiple schools.
Right.
Previously, I've just worked one on one with a specific school, but I'm trying to get that higher tier access so that we can build a curriculum so it can be implemented across multiple schools, and be standardized and uniform.
Right. Yes.
Hmm.
I love it. That is
Yeah.
absolutely a better way to use your time. Yes, I
Yes.
agree.
Yes. Don't want to keep
Wow.
reinventing the wheel.
Nope, nobody wants to do that. So
Absolutely.
that's great. So what would you tell a parent who says, okay, this is the only hospital I have access to. How can I, starting at home, how can I improve the health of my child? And
Hmm.
or what should I look for when I go to the hospital? Because
Yeah,
often they don't know enough to advocate for themselves. So what would you say?
absolutely. So that's a good question. I would say basic things that will help a parent educate themselves. There's a few websites that I like, and they have a duality of it's kind of provider focused and then also parent focused. So AAP.org is a great resource. So the American Academy of Pediatrics gives tons and tons of information on a variety of topics focused for parents and families to learn about.
Right.
So I would recommend to go to aap.org. Another really, really good website is kidshealth.org. And Kids Health, they have both in English and Spanish, where they have, again, many, many diagnoses or symptoms that families, even the patients and parents can learn about in terms of signs and symptoms, what to look out for, educational things, and it's very easy to read. So
Right.
kidshealth.org is another great resource. And then the third one that I like in terms of basics about nutrition and kind of lifestyle changes, uh, is myplate.gov. So that gives you basic information on nutrition that you can easily implement. I'll be the first to say that obviously trying to eat very healthy, it's a numbers game as well because
Right.
unfortunately it is more expensive to find these foods that are organic, not processed, and I understand that not every family's in a position economically to be going to Whole Foods every day. But I will say that there are little changes that you can make in your diet that will have infinite benefits. So, something as simple as decreasing the amount of soda intake and focusing on more water, for example, is a simple change that one is going to save you money because you're not buying as much soda and you're going to have those health benefits. So, myplate.gov gives you kind of tidbits that you can work on in any financial situation, and I think that's a good place to start in terms of basic nutrition education. And then the final thing, in terms of just in general advocating for yourself, I tell families every time when you present to an ER or your doctor's office, it's very important to make sure, however you want to express it, what your major concern is and what you're worried about for your child. You know, physicians, we're human, and especially in the ER, for example, there are often competing priorities in terms of tasks that need to be done and things like that. So, being the advocate for your child is really, really important. So, if someone comes in and they do their exam and you feel like you're getting blown off, you have to speak up and say, "This is what I'm concerned about. My child's not acting right, et cetera," so that we're all on the same page in terms of your concerns. Another
Right.
thing that I think is very helpful is to just write down your questions. So, especially if this is a planned visit, if you're going to see your primary care doctor, having questions on hand is very helpful because, again, physicians, we don't know everything all the time. And so, if there's something that has been specifically concerning you, bringing that up is very helpful for the clinician. So, it can help us focus on what is the major concern and how we can address that. So I would certainly advocate in terms of speaking up for yourself and bringing questions to the visit so that you're going to optimize the clinical time you have with the provider to make sure that we're addressing the issue and taking care of it.
Right. Wow. Yes, those are absolutely critical. It's always important to write down lists. If you can't write it down, put it on your phone. But
Yeah.
definitely, because sometimes parents come in and they have 4 or 5 things. So it helps for you to go one at a time so that
Mm-hmm.
we doctor can actually address all of them. Because if not, if you just say things randomly, then it's like, okay, well, we don't remember what you said 5 minutes ago because now we're
Yeah,
all
yeah, yeah. It can be very
what's
challenging.
going on
So,
now. So
yeah, I always say, help me,
yeah,
help you. Help me, help you.
yes,
That's it.
exactly. That's wonderful. So I have a question here from Davida, and she says, "Do you see any shifts in the future of pediatric ER care as a result of the pandemic?"
Good question. Um, so I think in terms of the pandemic, I know for sure mental health has been an issue. Having kids not be in school has been very challenging. And obviously, there's no clear cut answer, that it's multifaceted, but
Right,
there have been more issues in terms of depression, anxiety over the past 2 years with children because it's completely normal. Children are naturally social. It's important for their development to be socialized and around other kids and whatnot. So it has been very challenging during the pandemic in terms of that component because a lot of kids had to stay home for quite a bit of time, and especially if you think about the younger children, like a friend of mine, her son just turned 3, and you imagine from the time he was 1 or he barely 1, everyone was wearing masks, and so it's critical developmental stages, and so I think it's going to be interesting to see how that plays out over the next few years with this generation of kids who are school aged, who had a year, 2 years even, with the pandemic being outside of school, learning through Zoom and not around their peers as much. And
right,
I think that we really have to be in tune with that when we are seeing our patients and being thoughtful
right.
and considerate about always asking about any mental health issues that may be just beneath the surface. I always hark on the residents that, especially in the ER, uh, this could be, a 10-hour conversation, but we don't do great with primary care. So ERs are often the medical home for a lot of patients.
Right.
And someone could come in for a very simple concern, but especially if they're tween or teenage age, it's really important to ask about social history, as we call it, and any concerns, because a lot
Right.
of times that'll be the only time that they can express themselves and address any issues. So someone comes
Right.
in with a sprained ankle, just asking how school is going, how their home life is, and you might be able to tap into some issue they've been having and help give them appropriate care. So I would say that, again, pediatricians, our job is to take care of the whole patient,
Right.
and the pandemic for sure has been challenging with mental health. So making sure that we are more in tune with that and thoughtful about how we interact with the patients is really important going forward.
Yes, and in that same vein, it's so important, parents, that you also are aware that our kids are struggling. They may not want to say anything to you. So if you notice any changes in the way your child has been acting, they're more withdrawn. They're not talking to their friends as much. They they just seem moody more than the usual typical teenage moodiness, or even any age. Actually, we
Yeah,
always talk about the teenagers, but we also need to talk about the younger kids because they
absolutely.
too are facing a whole huge onslaught of not knowing how to handle the feelings that they have, the sadness, the
Hmm.
whatever it may be going on with them. So we as parents and also as providers, yes, we need to always have that at the back of our mind. Don't ever cross that off the list.
Mhm.
Because as we both know, Alana, kids can show up with symptoms, but it's just a symptom of what's going on with them mentally. Like
Absolutely.
they have abdominal pains, and we can order CAT scans, but if we
Yeah.
don't
Yeah.
ask how
It's
they're
very true.
really doing or what's going on in the home, or if we can help, then we're missing it. So I know it's hard to do sometimes in the ER, but it's important. Even a simple question as, "Mom, how are you doing?" Like,
Mm-hmm.
how are you really doing? You'd be amazed how many moms I've had like start crying in my office because I asked them
Yeah.
how they are
Yeah.
doing, not their kid, them.
Yeah.
Then they like start breaking down and saying what's really going on. So
Right.
that's just to encourage us all. Yes.
It's been a
Yeah.
very stressful time for the whole families for sure.
Yes, that's true. So if I work a lot with foster parents. So from your point of view, I know that when they come to the ER, what are some tips you can give foster parents who may not know this child as well when
Mm.
they come into the ER? What tips can you give them so that they can have a better interaction with an ED doc when they come in?
Yes. So, as best they can, as you mentioned, knowing the medical history is helpful. But also, it kind of goes back to what you just said, like just being open and trying to be in tune with what their concerns may be. So,
Right.
a lot of times they don't have a ton of information about the child, but just, especially if it's an experienced foster parent, what have they experienced in the past and what might be different that's going on with this child and what
Right.
they are concerned about. So it's really, really critical that we as providers are good listeners and give the family or the caregiver a chance to explain what they are worried about. And so just asking those questions can really help. um, I find that most foster parents are fairly patient, but also just making sure you give them a safe space to be a little overwhelmed or exasperated, especially if it's a difficult child, and not pass too much judgment on them because it is
Yes.
an extraordinarily challenging job to be a parent, let alone foster parent. And so, as a provider, I think we have to give them a little reprieve and a little grace in terms of that. So I would just say that if foster parents try to, be patient with us as providers, ask the questions that you may have, and just, I would say, seek help sooner than later if you are concerned about one of your foster kids. It can be very overwhelming, but I would always rather, it be a false alarm in terms of a child
Right.
than waiting until things get dire. So, because it can be a difficult situation, especially since they don't know the child very well and don't have the full medical history. If there
Right.
is a little inkling of something going on or they're concerned about either something physical or a mental health issue, I always tell them come in sooner than later, especially like ER. We're here 24/7. I'd rather see a child for something that can be dismissed and say that, okay, everything looks fine. I'd rather have that case than have
Right.
someone later with some major issue.
Right. Yes. I tell parents, I agree. Absolutely
Mhm.
right. And I tell them there's no such thing as a silly question. It's
Yes,
better
yeah,
to ask. Let's ask the question. Let's address it instead of us missing it because we're
yeah.
humans. We can miss things. So, yes, wonderful.
Hmm.
Wow. So, thank you so much for all the gems you have dropped. And
Oh, it's been my pleasure. Absolutely.
listen, hospital CEOs, schools, superintendents, talk to
Yes,
Dr. Alana. She is your person to help
yes,
you get
yes,
your ER pediatric ready. And we absolutely need it. Our kids are depending on us to take care of them. And we can't take care of them if we don't have the tools to take care of them
yes.
like they should be taken care of. So, yes, it's a wonderful pleasure to have had you on today. So, tell us, where can we find you?
Yes, so you can find me on LinkedIn, Alana
Mhm.
Arnold. Have my page up, and also on Twitter. building up my Twitter. And so my handle is Dr. Alana J. Arnold. And then if you feel so moved, you can check out my website for my pediatric readiness consulting. It is www.ajamedicalconsulting.com. So Twitter, my LinkedIn, and the website. And I would be happy to chat with anybody about pediatric readiness so that we can make sure we're giving the proper care to these children in the community.
Yes, I agree. And there is her website, ajamedicalconsulting.com. Yes, so wonderful. Do you have any last minute tips you'd like to share with our parents? Or
I would
anyone
just
watching?
say, just take care of your kids. They're a blessing to have a healthy child. Don't take it for granted. And certainly, please, please, please make sure you have try to maintain a good relationship with your pediatricians. Use them. We're here to help and get medical advice. Try to check out those websites to increase your health literacy in terms of just knowing what's going on with your child is really important. And yes, thank you for having me very much. I enjoyed myself.
Thank you. Same here. Yes. So thank you so much for everyone that's watching. I see you in the chat.
That's it.
Angela Arnold said, "Great job, Dr. Arnold." So
There we
great
go.
job. And Brother Bedford said, um, "Awesome." For some reason, it's not clicking. Oh, someone else. Rochelle said, "Thanks for sharing this info with us, Dr. Arnold." So
My pleasure. My pleasure. Thank you
yes.
guys for having me. Really appreciate it, Dr. Echo.
You are welcome. And so, yes. So if you'd like to be a guest on this show, this is the email where you go to send me an email. I'll be happy to talk with you at brainpowertv@gmail.com. And for more information on the nonprofit that I run for foster children, it's kidsofhope.org. You can find me here on LinkedIn at Hoke Echo MD. So it's been a pleasure. Have a wonderful day, everyone. Take care and be healthy. And God bless. Bye.
Thank you. Bye.